All right, today we're going to pull back the curtain on one of the heart's most critical, but honestly, often overlooked parts, the left atrium. Now, you might think it's just a simple chamber, a little waiting room for blood, but its design is way more complex and absolutely vital than you'd imagine. So, let's get right into it.
So let me just throw this out there. How on earth can one tiny chamber in your heart mess with your ability to swallow or even change the sound of your voice? Sounds a little crazy, right? Like, how could those two things possibly be connected? Well, stick with me because I promise by the end of this, it's all going to make perfect sense.
Okay, so first things first, we've got to cover the basics. Before we get into all the cool, weird stuff that can happen, we need to get a handle on what the left atrium is and where it actually lives inside that big four-chambered heart of yours.
So the left atrium, or the LA as we'll call it, it's basically the heart's VIP lounge for freshly oxygenated blood. Think about it. You take a breath. That oxygen-rich blood zips over from your lungs, and this is its first stop. It's the handover point before the blood gets passed to the real workhorse, the left ventricle. And what's really cool, and kind of sneaky, is where it's located. If you look at a heart from the front, like in most diagrams, you can barely even see the left atrium. That's because it's tucked away around the back, making up most of the heart's posterior surface. It's kind of shy. But this location is super important because it means it's bumping right up against some other key body parts. And yeah, we'll definitely get back to that later.
Okay, so we know where it is. Now, let's pop the hood and take a look at the design, the actual blueprint of this thing. Inside, the left atrium has this sort of split personality. The main part of the chamber has these really smooth walls, which makes sense because it was actually formed by absorbing the veins from the lungs way back when you were developing. But then there's this other part, this little pouch called the auricle, and its walls are all rough and muscular. Smooth versus rough. This difference isn't just for show, it has some major implications that we'll dig into in a bit. So how does all that fresh, oxygenated blood get inside? Well, it arrives through these four entry points. You've got four pulmonary veins, two from the right lung, two from the left, and they act like dedicated pipelines, dumping a constant stream of blood right into the back of the atrium. And of course, once the blood is in, it needs a way out. There's only one exit door here, and that's the mitral valve. This is the crucial gateway that leads into the left ventricle. The super powerful chamber that's going to pump that blood out to your entire body. Okay, let's circle back to that little rough-walled pouch we talked about, the left auricle. The best way to think of it is like a little storage closet or an overflow tank for the atrium. Its job is just to give a little extra room, increasing the atrium's capacity when it needs it. Simple enough, right? Well, this little closet can also be a real troublemaker. It kind of has a dark side. All right, a chamber can't just run on its own. It needs power and instructions. So let's talk about the plumbing and the wiring that keeps the left atrium going. The whole command and control system here is incredibly precise. The fuel, the blood supply, comes from the left circumflex artery, and its rhythm is controlled by two competing nerve signals. You've got the sympathetic nerves, which are like the gas pedal, telling it to speed up, and then you've got the parasympathetic vagus nerve, which is the brake pedal, telling it to slow down. It's this perfect balance that keeps it beating in sync with everything else. Okay, so we've got the blueprint, we've got the power supply. Now let's put it all into motion. How does this thing actually work, beat by beat? Believe it or not, it actually juggles three different jobs, all in the blink of an eye. First, it's a reservoir. It just hangs out and collects blood from the lungs, while the ventricle below is busy squeezing blood out to the body. Then, role number two, it becomes a conduit. The exit door, the mitral valve, swings open, and most of the blood just passively flows right through into the ventricle. Easy peasy. But then comes its final and most active role. It acts as a booster pump. Right at the end, the atrium gives this one last powerful squeeze. It's often called the atrial kick, and it forcefully pushes that final 20% of blood into the ventricle. It's like topping off your gas tank right before a big trip. And while 20% might not sound like a huge deal, that little extra push is absolutely crucial for getting the best performance out of your heart, especially when you're working out or pushing yourself. So it's a really elegant and efficient system when it's working right. But what happens when things go wrong? And this is where we finally get the answer to that weird question from the beginning. The one about swallowing in your voice? One of the most common issues is something called left atrial enlargement. So imagine that exit door, the mitral valve, gets stuck. Maybe it's too narrow or too stiff. That's a condition called mitral stenosis. Now the atrium has to shove blood through this tiny opening,
and it has to work way, way harder. And what happens to any muscle when you overwork it? It gets bigger. And this is the big reveal. Remember how we said the left atrium is hiding out at the back of the heart? Well, as it gets bigger and bigger, it starts to physically push on the stuff behind it. It can actually squash your esophagus, which, you guessed it, makes it hard to swallow. And it can also press on a specific nerve that runs up to your voice box, which can make your voice sound hoarse. A heart problem literally causing a voice problem. Wild, right? And what about that little storage closet, the auricle? Well, its dark side comes out during irregular heart rhythms, like atrial fibrillation. When the heart's not beating properly, blood can just sit and pool in that little pouch, and that's the perfect recipe for forming dangerous blood clots. If a piece of one of those clots breaks loose, it can shoot straight up to the brain and cause a stroke. So this tiny little add-on room can be a massive source of trouble. All right, let's do a super quick rundown of the key facts. The left atrium, it's the chamber at the back of the heart. Where does it get blood from? 4 pulmonary veins. Where does it send it? To the left ventricle through the mitral valve. What's it like inside? Mostly smooth, except for that troublesome little auricle. And what's a common problem? It gets too big, usually because of a faulty valve. So, the left atrium really is a perfect case study, isn't it? It seems so simple on the surface, but it's packed with this incredible design and has huge clinical importance. And it really makes you think, what other simple parts of our own bodies are we just totally taking for granted, not realizing the huge, complex role they're playing every single second? Definitely something to chew on.